We had a question that came in a little bit earlier about how artery blockages can ultimately impact the venous system and lead to ultimately chronic venous insufficiency as well.
Absolutely. So, the arteries and veins the arterial and venous system are two different systems for the most part. Arteries are higher pressure, they're more elastic. Veins are lower pressure, and they have these valves which help you have to work against gravity. So, a lot of these risk factors that apply to PAD also apply to chronic venous insufficiency. Things like being overweight, things like being sedentary, high blood pressure, cigarette smoking, all these things damage the veins and specifically the valves in the veins. And so usually artery issues are accompanied by vein issues. So, and then once you address the artery issue, you have good blood flow going into there. You're just not getting good blood flow out. And so more specialized centers like our own, we focus on a complete peripheral vascular, not just PAD, but PVD, to include the arteries and the veins, because we can get blood flow in there a lot of times, but it doesn't mean that we're getting blood flow out. And when it comes to venous insufficiency, chronic venous insufficiency, those valves in the veins are damaged. At that point, you're fighting against gravity. You can't get that blood flow back to the heart. You're getting all the blood in there. So what happens classically with these patients, by the end of the day, on your feet all day or sitting all day, the legs are really swollen. And these patients tell me, hey, in the morning, my legs feel great. Well, it's because during the day, gravity's pulling everything down. At night, when you're laying down, you elevate your legs and you're helping gravity pull it back to your heart. So that's why they look better in the morning. But veins should be addressed also after the arteries, because arteries are arguably more important. And again, if you're having symptoms that would indicate you have chronic venous insufficiency, big bulging, painful veins, swelling in the legs, walking pain, which you can get from veins due to the swelling and chronic venous insufficiency. So that's also a different topic, and these are things that we deal with here in our practice also. But yes, absolutely, it can affect the veins.